Bam, ba-da, ba.
You know what? Here, look, we got a different. We put out the wrong phone number for Dr. Amir. Here it is. This is the good one. Dr. Amir's phone number, ladies: 858-658-0595. 858-658-0595. Okay, now that that's corrected, let's get to our other doctor of the day. Our too many teeth crowding your smile. Well, Dr. Paul Coleman has instant improvement for your crowded smile. Hey, Dr. C.
Good morning.
Good morning. Okay, is it true that the older we get, our teeth naturally come forward and naturally crowd?
They can, especially on the lower.
Especially on the lower ones?
Right. They're easier to move around. They're smaller teeth.
See, some things are just so simple, right?
Yeah, a little bit.
Okay, but crowded teeth can be really bad. There was a statistic, 80% of Americans think a great smile is important, but most are not happy with their smile. Is this true?
Absolutely.
Really?
And the problem is most people don't realize how easy it is to correct some of these things. It can be done in just a couple of visits.
Really?
Absolutely.
Okay, well, let's start out with instant orthodontics. What is that?
Okay.
Because let me just say this for the record.
Yes.
My orthodontics weren't instant when I was a teenager, okay?
I understand. Okay, as an adult, there's a lot of people that don't even want to get involved with Invisalign and the months and months it takes to take teeth that are kind of awry or crowded or crooked and move them around. You know, at my age, there's no way in the world I'd go through that personally. But with the use of porcelain veneers, you can actually, in 2 visits, take care of crowding and just alleviate it permanently. You won't be in retainers forever. You won't be months and months of treatment. And just a couple of visits.
I still use my retainers. Do we have some before and afters for that we can take a look at? Our retainer is 32 and still using my retainers bad. Okay, here's some crowding.
Okay.
Here's some crowding.
This gentleman came in and he wanted me to take care of the upper crowns that he had done 25 years ago. So I gave him a mirror. I said, "Is there anything else you don't like?" He goes, "Well, the lowers are kind of goofy."
Yeah.
And I said, "Yeah." So we did 6 veneers on his lowers, and this was accomplished in 2 visits of about 2.5 hours.
What exactly is a veneer?
A veneer, much like the veneer on a table, is a very thin sheet of porcelain that's bonded to the tooth itself. So in a case of crowding, you take away the tooth that you don't want to be there and make room for the porcelain you do want there.
Okay.
So there's a little planning on the front part, but then it's accomplished pretty quick.
Does it hurt?
No.
Because you know I'm a wuss.
I know you are.
They give me a sucker when I come into Dr. Coleman's office. They're like, "Oh, Chrissy's here." Okay, let's look at some more before and afters. Let's see. What's going on with this patient? Wow, that's a big difference.
This young lady, she had her lateral incisors were kind of aimed out straight, like at me. They were sort of straight out towards her lip. Yeah. So we shaped those back and put some porcelain on the front, and we got rid of her crowding in 2 visits.
Well, okay, so the porcelain goes around the existing tooth. How do you keep the existing tooth inside healthy? I mean, could you have problems with the tooth?
This porcelain is bonded on as strong as your enamel is stuck to your natural dentin.
Oh.
These are really strong.
Okay, okay.
And we've been doing these techniques for 20 years, and the materials are getting better and better every year.
It's a big difference. And how many visits did it take to make that change?
All of these cases are 2 visits.
2 visits?
Correct.
Okay, do we have any more? Can we see more? I want to see more. Because this is a big difference. And let me just tell you, it took 2 years for me to use my braces to get my teeth straight.
She's a dynamite lady. She came in and she goes, "I'd like you to replace these 2 crowns, the teeth besides the space." And I said, I said, "How long have you had this space?" She goes, "Well, I had it as a kid and the orthodontist closed it." And I said, And I said, "It opened back up?" She said, "Yeah." I said, "What'd you do then?" She goes, "Then I put 2 crowns on." And I said, then the space opened up. So we had to investigate the reason why the space was opening up. It had to do with the fact her back teeth weren't long enough to support her front teeth. So we actually did her entire upper arch, gave her a different bite, got rid of her TMJ problems at the same time, and that was accomplished in a couple of visits.
I want to ask you about TMJ before we're done. We have 2 more I want to see. We have a couple of more before and afters that I want to take a look at. Oh my gosh, the big difference.
This gentleman actually flew in from, I just did this case 2 weeks ago. He flew in from Nebraska to have me treat this. And it's sort of like when David started, Michelangelo started carving David. You take away the parts of the stone that isn't David, okay? Yeah. So in this case, we took away the tooth that we didn't want to exist so we could put porcelain where we wanted it to, and that was another 2-visit project.
Only 2 visits?
Correct.
One more. Let's take a look at one more. The last before and after. Man, that is a big difference. 2 visits.
Now the thing is, if you got ugly teeth to begin with and they're crooked, and you go to an orthodontist, you end up with straight ugly teeth. Okay. So you know, you can go that route, and I'm sure the orthodontic community would just love you to do it that way. But, you know, we could save you a little bit of hassle and time if you want to do it a different way.
You know, you caught me off guard there because I was thinking, wow, how pretty. You just cracked me up, man. Yeah, you know, and it's 2 visits is all it takes.
Correct.
And I have been to your office before, and it's quite nice going
you.
up. It's in Rancho Bernardo? Was that Rancho
Poway, but you're pretty
Poway, close. Yeah, okay. Coleman Center for Cosmetic Dentistry, Dr. Paul Coleman, 858-748-4802, drpaulcoleman.com, or you can go to his website. So we'll talk about TMJ next time. I have some questions about that.
Perfect.
Thanks for coming in.
You bet.
Okay, well, Ribbon is at a Christmas tree